Dr. Peter Hanson, we're on the shores of Gichigami, Lake Superior. How do you feel when you're around this big water?
Yeah. I feel very good, and I think anyone that comes here, this is a site of healing and just a place to let it loose and see where the nature and spirit collide, and to let yourself come to terms with what the earth has to offer. As a physician, we spend much time in hospitals, busy fluffing around, making notes, talking to people, and we don't really get outside and see what's available for healing there. And so it's a pleasure to be here.
Health concerns in Indian country. You wrote a column for several years for the Lac du Flambeau News, and you wrote it in Indian, and you described some of the challenges people in Indian country face. What are those challenges?
The what you see is a pattern which tends to interact with a number of things: lifestyle, diet, economic situations, and this has produced a spectrum of diseases that are particularly pronounced. And the first one being diabetes, the second one being coronary heart disease, heart attacks, and the third one very close behind, cancer, various cancers. My interest is in the area of cardiology and the relationship between cardiology and diabetes. My mother died of diabetes many years ago, before the time that we had adequate measures to control diabetic complications. And so I've been very interested in detection of diabetes early and intervention, especially through diet and exercise, because that appears to be very effective in the early phases of what we would call pre-diabetes, the tendency to eventually develop it. And if you can delay the onset of it, even in spite of some adverse situations, family background, genetics, and so forth, it is possible to delay the development of diabetes.
What do you recommend for an exercise program or a diet program?
The simplest thing actually is daily activity in the form of walking, just plain work. It could be raking leaves, it could be splitting wood, it could be various activities in the bush which we don't do anymore. I used to be a runner. Now I do gardening, wood hauling, raking, other activities around the yard. Some people may not have time for this. You can substitute 30 to 40 minutes of walking. It doesn't have to be continuous. It could be twice a day. Weightlifting is okay. It doesn't have quite the effect, but it has been shown to be effective in controlling some patterns of diabetes. But any kind of exercise that you can do, as long as it amounts to about 30 to 40 minutes daily. As far as diet goes, the thing to watch early in life is excessive intake of carbohydrates, high density sweets, I would call them, especially pops with lots of sugars in them and caffeine. White breads. We have the four white foods that were brought by the commodity program: white flour, white salt, white lard, and what's the fourth one? Anyway, there are four white foods that we have to be careful of. White sugar, that's it. So sugar, salt, lard, and white flour. And unfortunately, the native population has taken that on as some of the primary food intake, and it's not the best. I once wrote an article looking at how a native diet would compare to a fast food diet. And for example, 5 to 6 ounces of venison, a cup of wild rice, a cup of raspberries, a cup of wogwogs, those are the fern heads, would be about 1,000 calories, compared to a Big Mac and fries and ice cream, which would be about 2,500 calories. So that's the difference.
What's your simplest recommendation about maintaining health?
I'd say diet and exercise is the cheapest way to do it. If you can control weight, try to keep it within a reasonable pattern for your height and body build. Not everybody fits the chart. There's a lot of very elite athletes that don't fit the charts that we have. But basically, if you've got a roll of fat around your belly That's the kind we don't like. That's called visceral fat or belly fat that's really around the internal organs. And that's the kind that's most associated with the development of diabetes and other complications of heart disease, high blood pressure, coronary disease, and diabetes.
Thank you, Dr. Pete. This is Nick Vanderpy reporting for News from Indian Country on the shores of Lake Superior.